Affordability, transparency, and value-driven healthcare. These will be some of the factors at the center of discussion at this year's Government Employees Medical Scheme, or GEMS Symposium, being held later this week. Now, the recent contribution increases for many schemes, including GEMS, actually triggered significant concern among members for medical schemes, motivating this year's symposium theme, which is building a sustainable and affordable future, enhancing member value in a changing healthcare landscape. Now, to talk to us more about the 2025 GEMS Symposium and other matters pertaining to medical schemes in South Africa, we joined in studio by Dr. Stanley Moloabi, who is the Government Employees Medical Schemes Principal Officer. Thanks so much for your time. Welcome to Morning Live, Dr. Moloabi.
Good morning, Sakina, and also good morning to the viewers of Morning Live.
I want to start by talking to the symposium and exactly the need for it and what will be at the center of it.
Well, apart from, you've read the theme already, we tend to want to share with our members, and that would be through our webinar, which is open for them to join via virtually. We then have experts in the health industry. Those would be your policymakers, health industry players, and also people who are just like your healthcare providers. And that's where we discuss, most of the pertinent issues that are facing us. And you have just mentioned the fact that contribution incomes are a challenge. That challenge threatens sustainability of medical schemes. And we're looking at exchanging ideas at the symposium. And then out of the symposium, hopefully we'll come up with ideas that will assist us in mitigating these challenges that we are having in sustainability. But apart from sustainability, creating value for members is very important. And that's another thing that we are going to be looking at in the symposium.
And I think that's a critical point for many South Africans who belong to medical aid schemes at this point, because given the constrained economic environment, many people want value for money. And what we're seeing is medical aid contributions going up, and seemingly we're receiving less value for money at this point.
Well, if you take it from the point of being a person who has to pay more and more, and then you see your medical aid contributions going up higher than your salary increase, then certainly that leg will start to worry you. And one of the problems with medical scheme insurance is the fact that it's not one of those things that you willingly buy. We often call it a grudge purchase. You have to have it in case. And that is why it is very important that medical schemes remain affordable, and it has been a challenge.
So how does GEMS measure that?
Well, obviously, we look at how industry trends would be one of the things. And then when we determine annual increases, we also have to look at why do we have to increase? We increase this annual contributions because our members are getting older, because technology is introduced that's more expensive. But we have to balance that against what our members can afford. So when we compare ourselves with industry, that's one of the measures, and that is one of the biggest things we had to face at the beginning of this past year.
So, as you say, things are changing technologically as well, and you have to keep up with all of these developments. And then, of course, there's a push towards NHI.
Yes.
And what role does GEMS envision itself playing in the broader scheme with that move towards NHI?
Well, let's look at where GEMS is. GEMS has been in existence, and one of the significant things about this symposium is that we have been in existence for 20 years. And over the years, we are covering public service employees, which is the biggest employee group in the country. So we're covering about 880,000 members. Now, that experience over 20 years of taking care of public service employees, we're using that experience to position GEMS and say, if NHI was to be fully implemented, what role would a GEMS as a medical scheme play? And if you look at NHI, in its current form, it's the one that's going to replace any form of funding of healthcare. It will be by the National Health Insurance Fund. What we are doing is that we are saying we want to be a partner, a strategic partner, in the implementation or the realization of universal healthcare coverage, which is what NHI seeks to achieve. So our role at the moment, we are trying to make GEMS to be able to play such a role in the future.
And also just adapting to where the healthcare landscape is moving to. You spoke about technology and innovation on that front, where perhaps people want to consult, virtually, things like that. But also just in terms of people's medical needs, things that may not have been envisioned 20 years ago, which are now a thing medically. How is GEMS making sure that it stays at least, if not abreast of, at least in line with what is happening?
Absolutely. 20 years ago, the world was completely different from what it is at the moment. So at the moment, two things. Artificial intelligence. So it is getting into the space of healthcare delivery. So we need to be able to adapt to a world where things like AI are very important. But on the other hand, also, members are just not buying the medical insurance. They also want to be incentivized in one way or the other. So when we talk about preventative health care, they are usually linked to certain incentives, and we are looking into that as a very important part of saying people want to, there's preventative care, there's exercising, there's healthy living. All of these things are important going. So these are all the things that we are looking into as the GEMS of the future.
Well, we'll leave it there, but of course we're very interested in hearing how the symposium actually went off. But thank you so much to Dr. Stanley Moloabi, who is the Principal Officer of the Government Employees Medical Scheme, or GEMS, and joining us in studio here to talk more about the 2025 GEMS Symposium and, of course, challenges facing medical aid schemes in South Africa.